to open up small healthcare centers by the government so that the people can visit there, they can discuss their issues and get treatment free of cost. All that was provided by the government. If proper menstruation doesn't occur, or if there is some problem in the reproductive health or the genital tract, what a woman should do or what a man should do, all that awareness is brought among the people. Hello everyone, a warm welcome to this session of concept class on chapter 3, reproductive health for class 12 biology. I'm Dr. Divya, biology faculty. So in the previous session where we had done chapter 2, we discussed about the reproductive structure, that is the male and the female. So in this chapter onwards, we will learn about the reproductive health. How healthy is the reproductive system and of the male and the female. So to begin with, reproductive health. So the entire chapter is based on how to improve the reproductive health and the factors that affect the reproductive health, and if the reproductive health is affected, what are the different technologies that can be followed to assist fertility. So all that we can study. So talking about reproductive health, we need to know what reproductive health is. So reproductive health is nothing but the healthy reproductive organs with normal functioning, that is the sperms. Say for example, the reproductive organ in the case of male is the testis. In the case of female, it is the ovary. Now, the testis needs to produce sperms. Is it enough only if it produces a countable number of sperms? No, it needs to produce millions to millions of sperms which are quite healthy. Whereas the female reproductive system needs to produce the ova or the egg also, which is healthy at the right time. So all that, if it is proper, then we call it as a good reproductive health. And according to World Health Organization, reproductive health means it is not just the way the reproductive organs of a healthy individual or an individual, that is be the male or the female, functions. So according to the World Health Organization, reproductive health means it is the total well-being of the individual in terms of physical, emotional, behavioral and social. So that is what they mean by reproductive health. So talking about the problems and strategies in reproductive health. So various problems which are faced because of the reproductive health and what are the strategies to overcome them. India is one among the first countries in the world to initiate a plan or initiate a program at a national level in order to maintain the reproductive health as a social goal. So, telling people or initiating plans by the government for the people to make them understand about the reproductive health was very, very important, and that was first implemented by India. And these programs in India, it was called as family planning, which was initiated in the year 1951. And among various programs that was initiated, family planning was one of them, wherein in order to, because in earlier days, people, that is women, used to bear child every year. That is, once she delivers a baby, soon after, without waiting, that is in 1 or 2 months itself, she would, or 3 to 4 months itself, she would be prepared to deliver another, or she would prepare to carry another baby, right? So that would cause a lot of ill effects on her health. So that is when family planning was initiated, and in this family planning, reproductive health of both the male and the female was also taken care. Next, talking about the reproductive and child health care program. So like how I told you, India introduced a new plan called as family planning. Apart from that, they also conducted some programs which are related to reproductive health as well as child care program. And their improved programs, it covered wider issues related to reproduction under the reproductive and child health care program. So these programs took a lot of initiatives not only to maintain the overall reproductive health of the women, but also it took care of various health related problems related to the children. So what are the main objectives of this particular reproductive and child health care program which was initiated in India? What are the objectives we'll look into? So one of the main objective was to create awareness. That is to educate the people why reproductive health is very, very important, and why a woman should maintain a certain period of gap before they conceive for another child, and what are the ill effects that are, or what are the different reproductive health issues that can come to a woman, and how they can maintain a proper hygiene and a proper medical treatment can be given to them so that these reproductive issues or reproductive health can be maintained. Apart from that, they also made sure that proper child care is given, because as soon as India got independence, the country was in a very poor condition, wherein there were a lot of poor people who did not know about the reproductive health or the child care and all that. So it was at that time the government implemented these programs so that proper food, nutrition and proper medicines also reach the children. So therefore, awareness was created among the individuals. Next is to provide facilities and support. So to open up small healthcare centers by the government so that the people can visit there, they can discuss their issues and get treatment free of cost. All that was provided by the government. And next was to introduce sex education. This was also very, very important because there was a lot of taboo among the people, and to eradicate all that in the schools, that is especially when the children or when the students in the school reach their adolescence, this education was being introduced to bring awareness among the children. Next is proper information was given, that is in the form of pamphlets or brochures or through radio, or vehicles were, that is through speakers, they were circulating informations regarding the child health care and various reproductive health issues, and also some of the other programs related to these that the government framed, all that were introduced to the people. So proper information regarding the reproductive health and child care was given to the people. Next, people were educated either through radios, talks, that is talk shows conducted by radios, or dramas wherein small skits related to this reproductive health and the child care was played in villages and all that, so that people get awareness about both of that. And awareness of the problems, that is, say for example, like earlier people would not maintain proper hygiene when hygiene related to the reproductive tracts or the urinary tract. So all that can lead to a lot of problems. So they were educated how to maintain the hygiene, especially in women during the monthly menstrual cycle and all that. Next is implementation of various action plans. So under this program itself, various plans and ideas were framed which were implemented. So these were all the steps that was followed by the reproductive and child health care programs. Next, let's look into the factors in improved reproductive health of the society. So what all factors were applied in order to improve the reproductive health of the society? So some of the factors are very, very important because these are essential to provide medical assistance and care to the people in reproduction related problems. So some of the people, they'll have, because of their poor reproductive health, they'll not be able to bear a child. So for such people, proper medical treatments, all that was introduced by the government. Next, implementation of better scientific techniques and new strategies time to time in order to provide more efficient assistance to the people. All that was followed by the government. So these are the factors in improved reproductive health of the society. So today, earlier, all this was not there. When it was implemented, these reproductive health and child care programs and all, when it was implemented, all these were not there. But today, some of the technologies have come up wherein the government makes sure that these technologies reach every corner of the villages or the poor people so that they can have a healthy reproductive life. Here are a set of factors which actually are involved in improving the reproductive health of the society. So one is bringing better awareness. That is, if proper menstruation doesn't occur, or if there is some problem in the reproductive health or the genital tract, what a woman should do or what a man should do, all that awareness is brought among the people. Next is decreased maternal and infant mortality rates. That is, earlier there was no, the science and technology were not that improved, or the childbirth, that is, the women would give birth to the child in the house itself, wherein proper hygiene was not practiced. Only older women who had experienced in giving childbirth, they only used to deliver the baby. So all that would happen. But now, because of the improved science and technology, and also in government hospitals also they have a separate maternity center and all that, so that for every woman can visit the hospitals and they can deliver the babies under proper hygienic conditions. So all this will actually decrease the death of the mother and also the death of the infant. So this is also one of the factors. Next is increased number of couples with small families. To say that hum do hamare do, that slogan that is usually there. So don't have more children in a family, that is more than two. If more than two is there, what happens? First of all, poverty will be there. More than two children, they'll not be able to provide proper food for them. They'll not be able to provide proper education for them, because they'll not be able to meet the expenses, daily expenses itself, they'll not be able to maintain. So always they took into consideration that the people made sure that the number of couples with small families are always better. Next is better detection and cure of STDs. So STDs are sexually transmitted diseases. So sometimes the reproductive health of a woman usually deteriorates because of this particular STDs. So giving proper information on how to prevent STDs for both the men as well as the women, that education was also done by the government, and that is also one of the factors here. Next is increased medical facilities, like for the poor people, wherein they can have some concessions in the medical facilities related to reproductive health, maternity and all that, so that they can go to the hospitals and get their proper treatment done. Next is ban on amniocentesis for sex determination. So amniocentesis, so in amniocentesis what they do is they extract amniotic fluid that is from that surrounds the fetus inside the mother's womb, and from that they'll try to determine the sex of the child, whether it is a boy or a girl. And earlier the that is female feticide was too much, wherein once the people got to know that it was a girl child, they would just get the child aborted. But now strict actions have been brought, wherein fine as well as the couple can be put behind bars, as well as the doctors who did this also can be put behind bars because of the ban on amniocentesis for sex determination. So all these programs are being launched by the government. So be it the private hospitals or the government hospitals you will visit, wherever the scanning chamber is there they will put a banner or a small chart will be put regarding the sex determination and how illegal it is. All those details will be written in that. Next is massive child immunization, because once we got independence, there was polio disease that was widespread in India. But years together, after massive immunization against the polio, or because of the polio drops and all that, nowadays we don't get to find polio itself, right? It's almost like it's not been eradicated, but it's almost like it is being eradicated, and we can control it because vaccines, that is prior to getting the disease itself at a very young age, that is the children who are 1 to 5 years of age can get their polio drops to prevent this particular disease. So this was one of the examples I gave. Or massive immunization for smallpox or BCG vaccines that are available now. So all these massive immunizations or these, but earlier what used to happen, there were a list of vaccines which the poor people could not afford. So only it was available in the private hospitals. But now even the government are providing these vaccinations, so that is especially for the children, these vaccinations which in private hospitals can cost up to thousands of rupees, the government is giving free to the children because to prevent various diseases. So therefore infant mortality rate also reduces there. So massive child immunization programs have been come up under this. Next, educating people. So this is one of the main things, educating people about the STDs. about the hygiene, about the assisted reproductive technologies, about various barrier methods to prevent pregnancy. All that education is given to the people. So these are some of the important factors which are looked forward nowadays in a proper reproductive health and childcare program. So this was about the session wherein we got to know what reproductive health is, and also according to World Health Organization, what is reproductive health. And also we got to know some of the programs that has been launched by the Indian government in order to maintain a good reproductive health of the individuals, and also various factors that have been implemented under these particular programs. So in the next session, we will talk about population explosion. And because population explosion can cause a major problem in almost all sectors of a life, right? And we also will learn about birth control. That is, as I told you, after having two children or one children, how to control the birth. Otherwise, if the birth is not controlled, it can again lead to population explosion, causing a lot of problems to the families and on the whole to the society and to the country. So therefore, what are the different birth control methods that can be adopted is also that we can study here. So these two topics we'll study in the coming session. So see you in the coming session. Thank you.